Today we're talking about
Preventative aging.
preventative aging.
Prevention is always easier.
There has been a hunt for the Elixir of Youth for time immemorial. We all talk about the fountain of youth.
So I think a lot of preventative really often comes back to lifestyle.
The number one thing you could use for age prevention.
The number one thing you can do for preventative aging.
The number one thing we can do to prevent aging.
Ladies and gentlemen, welcome your hosts of Skinterviews, the expert series, George Scandalis and Nathan Strom.
Welcome to Skinterviews, the expert series. I'm one of your two hosts. My name is George Scandalis.
And my name is Nathan Strom.
How are you, buddy?
Good, buddy. How's it going with you?
Oh, you know what? I'm a little upset from last episode, whatever you want to call it.
Why?
Because I'm an episode older. And I can't reverse the aging process as much as I would like. So,
But you know what else? What is good about this episode?
what is it?
Another sold out crowd from our live audience.
Well, you know, I mean, look at them. They're beautiful.
They are.
I think they're here for you or for me. I only see your wife and the kids, but, you know, look at that sign over there. George, you are amazing. That says amazing, right? I can't read that for
Oh, wow.
All right, enough of our silly banter. Let's actually get into one of the most important episodes of the series today. Today we're talking about
Preventative aging.
preventative aging. This is what we specialize in. This is something that we do in our careers every day beyond Skinterviews. This is something we talk about to all the people we consult, all the people we meet with, something our experts really want you to know. Why? A lot of times people say, oh, I want to do this, I want to do that, but it's so expensive. Why is everything that's really in your industry so expensive? Let me tell you what's expensive. Reversing aging. Preventative aging, though, can be a lot cheaper, can be done smart, and can have a bigger impact on how we age, how we look, and how we feel.
And if we simplify it, George, when you think about it, in our lives we invest so much money in, say, a house, our cars.
Absolutely.
And what do? We're always working to clean our cars, look after them, clean our house, upgrade them, renovate them. So why aren't we doing the same thing for our own bodies? Why aren't we looking after our own bodies in the same way so they can last the test of time?
It's a big question, Nathan. It's a big question. I like to think of our body and our face and our aging and our skin very much like an expensive car. The minute you take it off the lot, it's depreciating in value. The minute we're born, right from that very first breath, you are already aging. You're a breath older, you're a day older, you're a year older. Before you know it, you're me older. And this is where preventative aging really plays a massive role in how we're gonna look and feel longer about ourselves. Be confident.
And you know what? It's just some simple things, and we're going to hear from our experts later, but it could be just as simple as wearing sunscreen every day.
Well, it could be. So, if you want to know how to get that J-Lo factor where you look timeless, yeah, that's my girl. I love her. Well, not everything she says. That's another episode. But if you want to look like her for as long as possible and really redefine ageism and how we look and how we feel, this is the episode to take notes. So get your pens, your papers, your glass of wine, your coffee, whatever it is. I don't know what time it is you're watching this. I know our studio audience is excited to learn, and you're going to learn with us. Let's go to our experts.
Slowing it down or preventing it is always easier than reversing it.
Slowing it down is easier than reversing it.
Prevention is always easier.
It's easier to avoid the problem than it is to try to fix it after the fact. So prevention is always easier than trying to find a cure.
Right, so there's nothing we can do yet to formally halt the aging process, but there are things we can do to perhaps slow it down or at least deal with the signs.
Preventative aging, in my eye, is like taking the aging process, which we cannot stop, and maybe slowing it down, almost maintaining it. I think of it like an automobile, a nice car, something. It requires maintenance. We don't wait until the oil is dry before we change it. We don't wait until the paint is completely scratched and full of seagull poop and dirt and grime before we wash it. We maintain it. And we know with most things in life, if you maintain and you look after it, you get much better longevity throughout it. So it's better to maintain than wait until we have an end result we're not happy with and then trying to address it. And that's where preventative aging or pro-aging comes in. Very important topic.
I've heard so many people say, I'll just lay in the tanning bed or I'll just go on vacation because you can just laser it all off for me. Well, this is not true. You really should do everything you can to prevent aging, because once you've developed symptoms of aging, it is really difficult to reverse and have the skin look like it did before. So we can resurface, we can laser, we can Botox, we can peel, we can do all these things, but it's always better if you didn't get the sun damage in the first place.
You know, I think actually women aged better longer ago because they didn't count on somebody else to fix them. So if you looked at women in the 20s who were trying to avoid aging, they took a lot better care of their skin because they didn't think that somebody else was going to just be able to fix it later. And now we're saying, okay, well, it's a free-for-all. You could do whatever you want because I can get fillers or a laser or I can have a device or plastic surgery to try to undo that damage. And unfortunately, it can only undo it so much. And in the end, it kind of looks done.
Actually, you know, when I look at pictures sometimes of women from the 50s and 60s, they're so beautiful and they're natural, especially in the 70s, you know, that because there wasn't a lot of, because I mean, all the stuff we have now can make you feel great and look good, but sometimes also it can be used not well and people look kind of manufactured, right?
So we have kind of two sides of the spectrum. We have preventative aging, which is a softer, more controlled, more regular maintenance of aging, if you will. On this side, we have what's known as, or the lingo out there, is reversing aging. And this falls more into the major surgeries, the cut, lift, pull, the invasive things. And these are the things that often scare people. Okay, this is a scary thing. Again, and if I use the car thing, there's one thing to wax your car and keep it shiny and nice. It's a whole other deal to replace the whole front end because it's rusted out. So it's the same kind of thing. They're completely different entities. If we put more focus on pro-aging and preventative aging and follow some of the industry recommendations, we may never get to restorative aging or anti-aging per se, reversing it. So that's our goal.
There has been a hunt for the elixir of youth for time immemorial. We all talk about the fountain of youth.
So looking at strategies to prevent the aging process and the idea of a youth elixir has been around since ancient civilizations. And I actually find this quite fascinating. Cleopatra, to improve the appearance of her skin, bathed in milk. And through that, she discovered the benefits of lactic acid, which is an alpha hydroxy acid, for skin hydration, to improve the look, the texture of her skin.
She knew about glycolic acid before the rest of us did.
So I know everybody's talked about Cleopatra and bathing in milk, but I don't know if anyone's talking about honey. You know, to the ancient Greeks, they used honey for almost everything because it has a plethora of antibacterial ingredients. And nowadays, we use medical grade honey for wounds to treat them because we know how valuable it is, and it's sterile enough that we can even use on an open wound.
So the search for strategies to prevent aging is certainly not new.
And so in all ancient cultures, people have wanted to be immortal. They have wanted to live a really, really long time and be young forever. So there's always been that pursuit, but now we're getting closer than ever.
The number one thing you could use for age prevention
The number one thing we can do to prevent aging?
The number one thing you can do for preventative aging?
is sunscreen.
Sunscreen.
Sunscreen. If you had 100 dermatologists in the room, they'd all say sunscreen.
So first and foremost is to protect your skin from the sun every day. And whether you're spending a day at the beach or running errands, sun protection is essential. And you can protect your skin by things like seeking shade, covering up with sun protective clothing, of course, wide-brimmed hat, sunglasses with UV protection, and then using sunscreen that is broad spectrum.
So broad spectrum means it covers UVA and UVB. That you can tell typically on the bottle, so the labeling has improved over the years, and so often it will say broad spectrum or UVA plus UVB coverage.
SPF 30 or higher and water resistant is important as well.
I mean, sun is the biggest ager. It is, it's like hands down the biggest ager.
Photoaging actually produces the most cosmetically undesirable changes in the skin.
Number one cause of aging, of the skin in particular, is UV. UV light and also blue light, all this light around us, which is called blue light, also causes aging.
So what is photoaging? Photoaging is the result of chronic sun exposure. And I think the most interesting example of that is a New England Journal of Medicine article that was published. Maybe Nathan, George, maybe you guys can bring it up. So this truck driver had 28 years worth of sun exposure just on one side of his face. And the picture is dramatic, and it shows significant sun damage and aging on that one side, making it look 20 years older than the right side. This is probably the most compelling picture in history for daily sunscreen use.
So to give you an example, I had a patient, she had a twin sister. She grew up in Wisconsin, and her twin sister grew up in Florida, down in South Florida where I used to practice. And she showed me a picture. I mean, her sister, who was in South Florida, she looked like 10 years older. And I asked her, like, what's your secret? She's like, well, and I didn't know that she grew up elsewhere in Wisconsin. And she said, well, I just moved down to Florida. I grew up in Wisconsin. And so that was, to me, for the first time, I had actually seen it. You know, one thing is to read and know something. Thing is actually to see it with your own eyes.
Wear sunscreen every single day. Face, neck, chest, and hands. What happens over time? People wear their sunscreen only on their face, and then all of a sudden all their aging is starting to show and elsewhere on their body. So get in that habit.
Unless you've been living under a rock, you know that although the sun is great in terms of that bronze tan, that beautiful texture, sun and UV light is very damaging to cell on a physiologic cellular level. And those things, time after time after time, they're additive.
You know, the really sad thing about sun exposure is that you have a tan, and so you think you look good and healthier in the moment. But we know that under the skin, there are very specific processes. There's matrix metalloproteinases, there's thymine dimers that are forming. All these mutations, all of these underlying toxic processes that will take decades to show.
Tanning days will show up on your skin one day like this, because what happens is people look good, and one day they come to my office and they go, suddenly I have wrinkles, the V of my neck looks red and brown, and I never had that before. We think that photoaging is gradual, but it is not gradual. It is actually in chunks. And if you talk to any dermatologist, any plastic surgeon, they will tell you that suddenly they're seeing signs of aging. We don't know. We know that UV radiation is radiation that your body is sustaining. And as you're younger, you can compensate for that. And at some point you stop compensating, and your body remembers, your skin remembers all the radiation it has sustained. And that's why if you look at the V of your neck versus the breasts, for example, that may have been sun protected over time, the skin is totally different, less elastic, less little growths, and less little brown spots. And that's because you didn't sustain the same amount of UV damage in that area over time.
So there are definitely different categories of sunscreen. I do prefer sunscreens, so first of all, that are broad spectrum.
So I practice all these lines on my patients, and then once in a while I hit one that really resonates, and it becomes my like hero or star line. So I was telling my 20-year-old patients to please use sunscreen in all these different ways, and they were all like, whatever.
I do prefer mineral sunscreens. And the reason I prefer mineral sunscreens is because mineral sunscreens will typically sit on the surface of the skin. Unlike some of the organic sunscreens, they will not be absorbed into the skin. And therefore they do last a little bit longer, they protect a little bit better. And from a safety perspective, again, it's always nice to know that something is not being absorbed into the skin.
And then finally I said, nothing looks more beautiful in your 50s than sun protection in your 20s. And all of a sudden everybody's eyes lit up and they go, I get that. So I repeat that all the time. I post it pretty much weekly on my social media, on Twitter and Facebook and Instagram, because I find that message is so important. And when I find one that resonates, I try to make the most out of it, really.
Yeah, another big reason is sensitivity. So the organic filters certainly have a higher risk of what's called allergic contact dermatitis. Many people interpret that basically as a skin irritation or allergic reaction on the skin, where the skin can become itchy and it can certainly develop a rash. So that's far more common with organic filters than inorganic. I think the main thing, of course, is putting the sunscreen on and making sure that it's at least an SPF 30 or higher and that it's applied every 2 hours. So I think those are key components as well. So pick something that you're going to put on, but there are certainly sunscreens that have reasons why they are better than others.
So something as simple as being sun smart can help you age so beautifully. And look at women who've done this. Look at Meryl Streep and Nicole Kidman, who've been so good about protecting, and even J-Lo. She was just recently on a TV show and they asked her what is her secret to her beauty. And she said that she was so lucky that when she was a kid, a dermatologist told her to use sunscreen every day, and she listened. And she attributes that to why her skin is aging so beautifully and why she looks so good today.
Many people celebrate celebrities like J-Lo, Jennifer Aniston, Paul Rudd that look like they're not aging. And, I don't want to speculate on what treatments they may or may not have received, but I do think there's probably some preventative steps being taken beyond just olive oil.
I mean, celebrities look great. Of course they do. But they have access to things that you and I, normal folk, don't have access to. They have chefs preparing all their meals. They have extremely healthy meals because of that. They have personal trainers for 2 hours a day. They have a full night of sleep because they have a staff so they can outsource a ton of their responsibilities. Most people in everyday life don't have those luxuries, so it's important to take everything with a grain of salt.
So I think a lot of preventative really often comes back to lifestyle.
Look, there's no secret here. Back in the 50s, everyone used to smoke, and we can see what their skin looks like now. People used to smoke on planes, they smoked in movie theaters. Heck, they'd smoke right outside the operating room. Nobody used sunscreen back then, right? But rather they would smear baby oil all over their skin and go and bake in the sun until they're a nice, healthy, golden brown.
The toolbox that I have in terms of preventative aging, it's a big box. This is a big toolbox. But if I had to pick one tool out of that box, it would be hydration and nutrition. There is no doubt in my mind that if you want to see a true physical, physiologic, emotional, and real effect on a person, is have them well hydrated and well nourished. And by that I mean their skin, their glow, their capacity for their skin to heal. Hydration and good nutrition is the one tool that I'll take every single time.
You may want to consider drinking less alcohol. So alcohol can dehydrate the skin and in time damage the skin, contributing to an overall aged appearance. Having said that, red wine does contain resveratrol, which is a proven antioxidant. And when formulated in skincare products, it can benefit the skin. So although it may not benefit the skin when you're actually drinking it, there at least are some reported benefits to drinking wine. So maybe that works.
Okay, so you want a little tip? The best way to prevent aging? Watch what you eat. Interestingly, the most robust way to increase survival and modify age-related changes, including aging, is caloric restriction. In fact, caloric restriction is the only intervention that has been repeatedly demonstrated to prolong lifespan. So it's probably a good time to stop all that pandemic binge eating.
If you smoke, stop. Smoking greatly speeds up how quickly skin ages. It causes wrinkles and a dull, sallow complexion. Other things, you want to eat a healthy, well-balanced diet. So findings from a few studies suggested that eating lots of fresh fruits and vegetables can help prevent damage that leads to premature skin aging. Research also suggests that diets containing lots of sugar or other refined carbohydrates can actually accelerate aging.
Okay, because I'm feeling a little extra generous today, I'm going to give you a second tip, and that is sleep. When you sleep, Your skin's in repair mode, and the cells repair and rebuild at all stages of sleep, but really the majority of the cell turnover and the regeneration occurs during REM sleep. It's cheap, it's effective, and it only costs you that extra hour of Netflix that you didn't have to watch anyways.
So there have been a number of studies indicating that lack of sleep can be detrimental to the skin. So it is important to be getting enough sleep. One study looked at people getting 7 to 9 hours of sleep compared to those getting 5 or less. And those getting 7 to 9 hours exhibited lower skin aging scores, better water retention, that kind of reflects the skin barrier function. They had better recovery from redness. I'm not aware of any data that shows that if you slept more than this amount, you'll benefit your skin even more, but certainly there is some research supporting the idea of getting your beauty sleep.
Aging, I think, is accelerated by inflammation, because inflammation makes free radicals and it damages things. So if we have anti-inflammatory diets, if we decrease the amount of pollution that we're exposed to, if we exercise, we've shown that that decreases inflammation. If we sleep better, that decreases inflammation.
Get plenty of sleep, at least 8 hours. Try to sleep on your back if you can. It's really hard to do. And also wash all your makeup off at bedtime. Don't leave your makeup on and go to bed in it.
Eat healthy, sleep enough, and reduce your stress. Those are the 3 cheapest ways where you don't even have to see any of us. Okay? You can do it on your own, and you can do all that information is online. So there's no excuses for that. Those are the first 3 things.
So we all know exercise is good for overall physical and mental health, but there's evidence that it can actually also benefit the skin. So as you begin to break a sweat, your heart's pumping, the increased blood flow delivers nutrients and oxygen to the skin. This can keep your skin healthy, may promote a little collagen, which can also help prevent wrinkles.
I often talk to my patients about that, and I live it as well. I try to exercise, I try to eat low inflammatory foods. I wear my sunscreen not only for the UV, but for pollution. So I use a physical block with titanium and zinc, because pollution is a big ager. And there's actually studies to show people that live in cities with exhaust and nitrogen, free radicals, they get more wrinkles and more brown spots. So getting out in nature, away from pollution.
So the environment plays a huge role in the aging process. And of course, if you have good genes and good environment, you've won. If you have bad genes, you definitely need a good environment. The worst thing is if you have bad genes and bad environment. Let's say you have genes that make you prone to cancer or other immune disorders, and you happen to smoke or be diabetic or just have poor nutrition, those could, significantly affect your genes and your lifestyle.
Genetics versus lifestyle, it's a great debate. Some people absolutely do nothing their whole life and look amazing. There's skin color in many cases definitely makes a difference. The more melanin you have in your skin, the more intrinsic sun protection you have. So people with, olive skin, people with brown skin, and people with, darker skin, they are less likely to get photoaging, and people with very fair skin photo age very quickly. So genetics definitely plays a role in how quickly people age, how quickly they wrinkle. And so that's the part that you just don't have control over. The part you have control over is a lot of it. So sun protection, getting plenty of sleep, not smoking, not stressing out, meditating. There's so many things that you can do to prevent aging.
I don't want to do a facelift on a patient. I don't want to take a needle and cut someone's face to get them the result. If I can go back and preventatively age people by keeping them well-nourished, well-hydrated, UV care and sunblock, and prevent that, then I've won and they've won. That's the goal. So we talk about intrinsic aging, extrinsic aging. And typically intrinsic is the inside. It's your genetics. It's, wow, she looks just like her mom.
Intrinsic are your genetics, your natural aging.
But I can tell you that if you take that individual with great genetics, as we call it, or another individual who doesn't have such great genetics, we can influence their appearance by controlling the extrinsic factors. Those are things that we can do. I can't change the DNA, but I can change what I'm exposed to.
Extrinsic is all the stuff that you salt your body with. Photoaging from the sun, all the things you eat and drink, everything that bombards us in life.
Control the things you can. Little bits, often and frequently. I think of it like maintenance. We'll do all kinds of stuff. We'll maintain our cars, we'll maintain our pools, we'll maintain our houses. But we have to get people in the mindset of maintaining yourself.
We often talk about rejuvenation of the skin, but there's also this idea of prejuvenation, where you get the benefits of rejuvenation, but the focus is really on preventative cosmetic treatments.
The top 5 treatments that people come in here for preventative aging, Botox is number 1. It's quick, it's easy, no downtime.
So there was one commonly quoted study that compared the effects of Botox on facial lines in identical twins. And one twin had undergone regular Botox treatments over the past 13 years, and the other one only had Botox treatments twice, several years prior. And the results found that the twin treated with Botox regularly didn't show as many of the signs of aging as her minimally treated identical sister. Neither twin received treatments in the lower half of their face, and interestingly, there was a similar degree of aging seen at that lower face, supporting the belief that the differences seen in the upper face were directly related to the Botox treatment. The twin sister who had regular treatment is on the right. You can see her skin looks smoother and overall younger. So the researchers concluded that long-term treatment with Botox could in fact prevent the development of facial lines like forehead lines and crow's feet that are otherwise more visible at rest when left untreated. And there's been further research supporting the cumulative improvement on wrinkle reduction and additional skin quality attributes with regular neuromodulator treatments. So Botox injections have been shown clinically and even with histologic under the microscope evidence that they can affect fibroblast activity and stimulate collagen production, which may produce improvements in features associated with that more youthful, glowing skin.
Fillers is probably number 2. My practice is full of patients who want to either recontour their face, reduce lines, or that kind of thing.
We know injecting hyaluronic acid filler can help to fill, lift the skin, but many people wonder about the long-term effect and whether the improvement is just temporary. So backing it up a little, collagen is this natural ingredient present in your skin, and it makes that resilient, smooth, elastic, sort of plump skin. And without it, your skin can develop fine lines and wrinkles. And studies have shown that injectable fillers containing hyaluronic acid not only immediately plump the skin, but they can also have a long-term effect on stimulating collagen type 1. And while the effects of the HA or hyaluronic acid wear off with time, that collagen effect is longer lasting, so you may be better off years down the road after your filler treatment with that extra filler-induced collagen on board.
So broadband light is certainly something that we commonly use and has robust evidence with regards to preventative aging. So it's something we talk about quite often here.
And there was an interesting study with BBL alone where 15 patients received BBL 1 or 2 times per year over 5 to 11 years. And when 491 blinded evaluators ranked their photos, the treated skin appeared to have aged a median of -2 years, even though technically they aged a median of 9 years during the study period. So they actually looked younger after receiving these regular IPL or BBL treatments over the years. So I think we certainly know there's a benefit to some of these treatments for overall prevention and anti-aging.
Bella Micro Gold is the micro neuromodulator that we inject into the skin with 6 micron, very fine gold-plated needles, and it perfects the surface of the skin. That is an amazing treatment that people always come back for.
Various skincare products, so the scientifically based skincare products, including things like exfoliants or AHAs, BHAs as they are commonly known, to vitamin C preparations, often in a serum form.
So vitamin C is a powerful antioxidant that can help to minimize fine lines by stimulating collagen, brightening complexion, evening out skin tone, and diminishing dark spots.
Other types of either exfoliants or ingredients that will prevent hyperpigmentation. So ingredients that inhibit enzymes that will lead to pigment production. Pigment is definitely a big thing that people want to prevent and treat. So those are common ingredients that we often use in some of our skincare products, and there are a number of them.
Jesner peels, very mild, very little downtime. People come in consistently every 3 or 4 weeks to do Jessner peels and just keep their skin looking glowy and smooth.
We can't forget about retinols and retinoic acids.
This is often referred to as the holy grail of skincare ingredients, and for good reason. Topical retinoids can help with everything from photoaging, skin texture, pigmentation, as well as acne. But specifically with aging, retinoids stimulate the production of collagen. That can help reduce the appearance of fine lines and wrinkles. It's been also shown to help fade hyperpigmentation by increasing cell turnover and reducing melanin production.
Kind of an abundance of lasers, ranging from lasers to treat redness, to treat pigment, to prevent pigment, to prevent redness. And then lasers to, again, target skin texture. So whether somebody is starting to, or let's say season their parents, for example, oil glands, oily skin, prominent pores, we call rhytids or wrinkles, they're going to know that those things are going to happen to them as well. And so sometimes I think the most common thing we hear is, my parent has this, and that's what I don't want. So how can I prevent that? And so that's really what we aim to do, is use these types of technologies to prevent whatever it is that patient is not wanting to develop, that they have seen is already in their DNA and that they are probably genetically predisposed to getting.
The Guanche lift, where I do strategically placed off-face filler, so in the areas where you would normally have your facelift incisions, and it helps to lift and redrape the skin with no downtime. It's thrilling for people to see their amazing results, and they don't have to tell anyone, they don't have to have downtime, they don't have to have surgery, and so that's one of our most popular procedures here.
We do use things for skin tightening that are, again, non-laser based, so things like microfocused ultrasound and radio frequency, for example, would be other non-laser based technologies that are very commonly used for prevention, so often to prevent laxity of the skin, which unfortunately, again, does happen with aging.
Yeah, so other treatments include things like radio frequency, ultrasound, IPL, microneedling treatments. All these treatments can stimulate collagen for long-term improvements.
There are some medicines that are being studied now. It's metformin is one of them. It's considered a senolytic. In other words, it reverses signs of aging, and that is such an exciting field. There are many other drugs that are now being identified and studied for age reversal. And basically it is an interesting, I could go on for like 2-3 hours about it. It's where we're taking away your senescent cells. So senescent cells are the old ones. They're secreting these factors that are telling your other cells to act old. It's just like when you see one edge of a leaf turn brown and then all of a sudden the rest of the leaf turns brown and dies off. We need to get rid of those senescent cells. So that's one of the ways. Metformin is a diabetic drug, and we happen to know that sugar, high sugar content in our bloodstream, glycates our tissues. It adds glycation moieties, little sugar molecules, to the tissues and makes our vessels firmer, our skin firmer. So when you move your skin, it cracks and wrinkles instead of being flexible. Same with your blood vessels. So it's like analogous to being diabetic, but for a prolonged period of time. So we want to decrease our sugar intake, but also metformin helps control the peaks of sugar in our system. So it may be one of the ways that it works in reversing signs of aging.
I am one of the biggest fans of bioidentical hormones. I talk about this with almost every female patient who is at perimenopause.
So when I went through menopause, I had trouble sleeping and trouble focusing. So I started bioidentical hormones. They're creams that you rub in. And it's interesting. It's not well taught in medical school. There's a bit of controversy about it. But I always say to my patients, the proof's in the pudding. Like, I feel better, I sleep better. And I mean, I'm not recommending them because I don't know that much. Like, I don't prescribe them, but they've helped me.
We know now that bioidentical hormones can help you not just avoid some of the signs of aging. And that we know that you can lose up to 30% of your collagen in the first 5 years post-menopause. And it's not just your collagen that's aging in isolation. We know that women, as they pass menopause, have higher risks of heart disease, osteoporosis, and dementia. And all of these can be balanced out with bioidentical hormone replacement, along with other things like exercise, especially weight-bearing exercise, along with being very careful about your diet. So bioidentical hormones, along with paying extra attention to these other lifestyle factors, can really help women age more beautifully and also stay healthy through their very exciting and active postmenopausal years.
I'm definitely pro bioidentical hormones, but you definitely want to get checked and make sure that you're a candidate, that you don't have clotting disorders in your family, that you don't have a personal history of one, any receptor positive breast or uterine cancer in the family. So a lot of things need to be checked. You need to be carefully monitored, but a reasonable amount of bioidentical hormones is amazing and can increase vibrance and longevity, I believe. And also in men who do supplements of testosterone or growth hormone judiciously look and feel great. The problem comes in again when people go into excess and when they start developing a problem and they don't scale back on these medications. So they need to be done with the guidance of a physician who's going to take great care of you and tell you when to scale it back if you need to.
And I'm never giving up my bioidentical hormone. I mean, no one can ever take that away from me. You wouldn't want to. You wouldn't even want to try it.
In 2050, we're gonna see more of what we have now. There's a huge demand for it. As long as there's a demand for something in medicine, as long as there are people to pay for it, the innovations will be there, one after another. There are so many things coming down the pike to help reverse signs of aging, but also to prevent aging. We're talking about supplements, we're talking about behaviors, we're talking about mind, body, all that, and every generation lives longer than the previous one, and every generation looks better than the previous one. So if you think about it, it wasn't that long ago people drank and smoked all the time, right? And now we know that doesn't look good. That doesn't make your skin look good. It cuts off oxygen, and so everyone's just learning as they go, living longer and looking better for a longer period of time.
The question also comes up, at what age do I consider having a facelift? At what age do I consider having surgery? I would love for the kind of thought process out there to be more, how can I get to a point where I don't need surgery? I don't need Dr. Howley. I don't need a facelift, a blepharoplasty, a cut, a pull, a fill. I don't need it. Now, ultimately, we are going to get there. But let's look at more preventative stuff. Let's keep this ship rolling smoothly as long as we can so that you don't have to do these things.
I'm not an ageist. I judge on the physical characteristics of the changes that have already occurred, right? There's no hard and fast rule for when surgery is appropriate. And I don't believe in preventative surgery. Look, surgery is a treatment, not for prevention.
Well, in terms of starting sunscreen, I mean, my kids have already started their preventative aging process because they wear sunscreen all the time. So they don't leave the house without their sunscreen on, and even in the house if they're staying all day, we just make sunscreen part of a routine.
I think you should start like from the beginning. Your parents should be instilling that in you as children, like cover up, wear sunscreen, eat healthy, exercise, sleep well. All that stuff will guide you throughout your life.
Well, when I think about preventative aging, I used to get this question from magazines all the time, and I used to say, well, prevention actually starts at birth. I mean, once you're out, the clock is ticking, and it's time to be careful. But it actually is kind of true in the sense that it means different things at different ages. So when you're a baby, it means getting enough sleep, and it means, using physical protection like clothing. And then as you age, it may mean adding in a bit of retinol and upping your sunscreen game and watching your diet. And then as you get a little bit older, it may mean adding in some of the treatments we do to sort of hold things back and help prevent them from getting worse. So the age at which you start can be very variable.
I mean, as far as the nuts and bolts of neuromodulators and all that, I mean, my sort of baseline rule of thumb is if you're having wrinkles at rest, because Neuromodulators are for dynamic wrinkles. You can start Botox at that time, whether you're 20, 30, or 40. But I'm not a big pusher of starting things really, really early with respect to injectables to prevent aging. I think that they work pretty well once you start seeing fine lines, that you don't have to start it in your teens or your 20s. That's my personal view.
I do see some patients who genetically, even in their 20s, whether it be just genetics or whether it be extrinsic factors, they really are sort of showing some of the signs of aging that we typically would not see in someone in their 20s. And so sometimes a patient in their 20s has a more robust skin health plan than, most of the patients in their general age group. So I don't think there's necessarily a specific age. We certainly see people of all ages. I think the key message is it's never too late to start to have a skin health plan, but there isn't a one age fits all.
When it comes to injections and fillers and surgical options, I don't really think it goes by an age. And I don't really ask my patients how old they are. I actually don't even like the question, because I think there is a difference between how you age. And even like how the English language asks this really annoys me. We ask somebody, how old are you? Already implying that, well, you're already old. When you think about it in French, they say, quel âge as-tu? Which is more like, how many years do you have? And it's more of a reverence for that aging process. In French, they don't even have a word for the number 80. They have 80, which is 4 20s. You're 24 times in French. They're so beautiful about how they do it. And 90 is 4 20s plus 10. It's 90. So even 90 is so youthful. And other cultures really revere age. And we want to prevent some of the changes we see so we can be alive and look beautiful and feel relevant, but we don't discard people as they age. So I don't think it's always important to prevent some of the things. I think it's important to prevent the toxic part of aging, which is 90% lifestyle choices, not our genetics of how we age. So I want to optimize genetics, and I think that's the best way to prevent aging.
Is it vain? You're asking me something that is embedded in our reptilian brain that goes back millions of years. And the reason why people label it as vanity is because society did so. We have to understand the difference between societal norms and really basic human wants that go back to our reptilian brain millions of years, that even if we try to fight it, we're going to lose that battle. And that's why people are confused. Everybody wants to look their own, the best self, best version of themselves. But then depending on what culture they're from or what society they live in or have grown up in, they have this heavy burden of this judgment of the society they grew up in, called vanity, that where they're fearful of breaking out of their shell and doing what comes natural to them, which is looking the best version of themselves. And those people suffer. There is a huge psychological component to what we do. And I happen to been gifted with that type of what I call social intelligence to recognize that. So when I talk to my patients, I'm truly trying to address that issue and to help them, to guide them, not to feel guilty, not to make decisions based on the label of vanity or judgment, to basically be free and live free and make decisions freely as they want, not how others might look or frown upon them.
I don't think it's vain to want to look great forever. I think it is, at least in my world, something that a normal person would want to do. Be vibrant, healthy, and live a really long life.
No, I don't think so. I mean, if you feel good inside, you often look better outside. So preventative aging is not just about what you're doing to your skin, it's about what you're doing inside. And that comes back to inflammation. So no, it's not all about vanity. It's about feeling good about yourself.
Now we talk about health span rather than lifespan. So when I tell someone, I want to live to 120, and that's true, I do want to live a long time. I don't want to live to 120 the way people live to 120 now, where all their faculties are diminished and they can't see well and everything hurts. I want to have a long health span, meaning that I'm vibrant, I can be a part of life, I can see and do things. That's the important thing, I think, now to distinguish is health span versus lifespan.
Yeah, I feel really, really good right now. I'm in my 50s, I'm menopausal, but I feel I have this wisdom and sense of who I am, and I think of my true self, of what really makes me happy, and I think that really comes out. How do I feel? I feel 10 out of 10 right now, yeah.
You know, recently I went on vacation to Turks and Caicos with my family, and every activity that we had was in the sun, and I realized I never go in the sun, and I always have my sunscreen on. And it was kind of daunting to be on the ocean with the reflection and being in the sun for every single activity we could do there. So yes, sometimes your family or something that's happening just has to take precedence over protecting your skin. So yes, I do sometimes do things that damage my skin, but I come right home and do a million peels and try to do everything I can to reverse all that.
So I use every day a mineral sunscreen to protect me against UV and pollution. Underneath I layer an antioxidant, vitamin C, stable vitamin C in 15% concentration, because vitamin C has to be stable. Otherwise it's going to be useless once you put it on your skin. And there's good science to show that it helps decrease the sort of oxidative stress that you go out into the day and are exposed to. And at night I use retinol. Now not everybody can use retinol. I use retinol, not retinoic acid, which is prescription strength, because I'm quite sensitive and I get irritated. And sometimes in the winter months when I can't use that, I'll switch to a peptide. Matrixol is an ingredient that I look for in products because again it has some decent science. And yeah, those are the main things. I think most dermatologists would sort of agree with all of that.
So if I could have one tool, let's put the industry products aside for now, well hydrated, well nourished, with good sunblock, that's where I start. Every single person that we're going to talk about preventative, pro-aging, we start there. Then we move on to the other things that have been proven biologically, proven scientifically, and work. Our vitamin C's, our moisturizers. These are things now we start to layer them in. But it behooves me to start a patient who's not done any type of preventative skincare on a vitamin C product while they don't drink water and they're sunbathing all day in the sun. I mean, you're not going to get the result they want. So, simple sometimes is your best solution.
So before you go nuts and start blowing your budget all over the place, remember, bring it back to basics. Eat well, sleep, exercise, don't smoke, and wear sunscreen. Costs you nothing.
Thank you so much for watching another episode of Skinterviews. Don't forget to follow us on skin.tviews on Instagram and Facebook and LinkedIn. And then also...
Sorry. Do you want an appointment for Botox? Because...
100%, I need to look at this.
Preventative aging?
Yes, I know.
Preventative aging. Don't forget to tell them where to follow us and where to get on the episode.
Skinterviews.world. And next week, we can't wait to see you for another episode of Skinterviews, the expert series.
The producer is going to kick your butt that you said next week. We're not allowed to say timelines.
Okay. Next episode.
Next episode. You owe me one. See you, everybody.